When you have a headache, when you have some tension around in your head, one of the possibilities underlying this phenomenon, this symptom you are experiencing, could be that the drainage, the blood flow out of your cranium, skull, so the blood drainage from the nervous tissue, your brain, the nerves inside your skull, they are somewhat restricted in their outflow. This could cause a relative congestion inside of your skull, and your blood has to find ways to get out of this system. And there are two very big pathways in which the blood can leave your, let's say, your nervous system, so not only the skull but also your spine and all the way down to your sacrum and coccyx. So there are two main pathways that your blood can take out of this system. The big ones, of course, there are a lot of smaller ones as well within the spine, the holes, the foramina within the two vertebrae, where your nerves are coming out as well. This is the possibilities, but there are two big possibilities as well. One is down in your small in your pelvis area, and the other one, I won't talk about that one right now. The other one is here. It is to do with your jaw. Now, is it necessarily your jaw? Well, anatomically, not really, but it's so close and so functionally related to each other that you could say it is part of your jaw. Well, when I say jaw, I mean the joint, this joint that you can feel going out. It is your lower jaw connecting with your temporal bone on your skull. This is where the joint is located and where your jaw is able to open and close. Now, if I'm gonna show it to you, I have a skull here, very pretty, a lot of colors. You can see here when I open this jaw that this joint is located here. So it has a connection to this temporal bone on your skull, which has your ear/hearing component, not your earring. That's a little bit here, but so this is a joint. This can open and close, and a lot of muscles that are connected to this jaw. We know the masseter, the temporal muscles, they are coming from here towards there, but there are actually a lot of small intrinsic muscles that are very important for this as well, which are located more on the inside of your jaw. So when you open your jaw, actually, you see the yellow part here. Actually, there are a lot of muscles there connecting it, opening this jaw. So this is very important, as well as closing, by the way. It's also due to a specific tension in these muscles. Now, when you're going through daily life, of course, you won't be hanging your jaw like this, going around like this. It's a bit weird, no one does that. So systemically, there is something that holds our jaw together. Now, these are the muscles from here, also from here, but also within here. And this area is quite interesting. Why? I will tell you in a minute. This area here, this bone actually, well, this part of your bone, you see the yellow part is connecting here and here. This is one big bone going from left to right. This is the pterygoid part of your sphenoid bone. Now, I have some nice pictures here, anatomy pictures, which demonstrate the connection this region has with blood flow out of the skull. And I will show this to you. Here, you can see it. Here, you see the teeth, lower jaw, upper jaw, the ear. So this is the region which I just showed you. They cut away part of the lower jaw. So here is the joint, the jaw joint, temporal mandibular joint, and underneath it you get to the region which I just showed you, the pterygoid region. Now this region is a plexus. You can see the blue lines. It's a nice picture because you can see it very vividly, that the rest is black and white, and this blue lines is the blood flow going down to the heart. Now you see there a plexus. A plexus is a, how do you call it, conglomeration of all these veins. They cross each other. It's not like a big vessel, which just directs one flow. No, they are very small vessels, but a lot of them. And because they are small, they don't have a big structural wall. The walls are quite thin in these small veins. It's not a capillary, it's not a venule, it is a vein, but it's a small vein. You can see here, this vein is already a lot bigger. So because this wall is so small, relatively small, especially when you compare it to an artery, which is a big wall, a big strong wall with a lot of muscles which have to resist the pulses coming from the heart, a lot of forces going on there. This wall is quite small here, especially there. And interesting, what is interesting in this area is that there are a lot of these small vessels, small veins, and because they don't have a lot of resistance, because, well, the flow there is relatively with minimal force behind it. Also it's going downstairs, so it's going with gravity. It's not very, it's quite loose, like, okay, just going with the flow, right? It doesn't resist much force. Now most of these vessels, they are going down, right? And these jaw muscles, which I showed, well, I didn't really show you the jaw muscles itself, but these jaw muscles from the pterygoid area towards the lower jaw, they're going like this. So they are really interfering, like crossing here with these veins. This jaw area already has a state of tension because we don't walk like this all day. We keep them close, and actually when you are stressed or when you are doing something, you're very into it, or you are very shocked, fight flight you could say, or fright also, these jaw muscles, they will tense. They are the first one probably to tense. They are going to grind itself. Now this can lead to problems related to teeth grinding. So like you hear it. I actually have some patients, they tell me they grind so hard that their partners wake up from it. So this is a real issue, especially in this hyper alert society where we are, we might need to calm down a little bit as a people. These muscles, they are always quite tense and they cause a lot of grinding and tension in the jaw. Now what does this tension do to these veins? They tense up. And these veins are not just normal veins, well, they are normal veins, but they are not normal in the sense that they actually take blood away from your skull, from the nervous tissue. And I'll show you here. It's a little bit smaller. This is the plexus, which I showed you, a lot of smaller veins. Now you can see most of this input is coming from here, from your eye region. And here, most of the input from that region comes from within your skull. So this is a big area where blood is coming out of your skull. Blood which carry the metabolic wastes from your nervous tissue. Now, if this gets congested, of course this can cause symptoms like headaches. So what to do about this? Now that I've told you this information, I have 5 minutes left. I have 5 minutes before I have to work again. So I will jump to it. What do? Well, we have our jaw. We have this area here that is located within the jaw, or well, medial or inside the jaw. So how can we approach working with this area? This is something I do a lot with patients if it is necessary, or I think it could be applicable for them as an individual. But you can do it on yourself as well, and I will show you how. You take your finger, right finger, if you want to work with the left jaw. You go, I will show it later on my jaw, but you go here, so the upper jaw, maxilla, you slide across and you feel the last teeth. Now if you go behind this last teeth or tooth, you will feel you are like looping inward. I will remove the jaw. You are looping inward. You see the motion going inward, and you will feel when you are going inward a resistance. Now this resistance can be the bone, but there's a lot of soft tissue around it, and the soft tissue is muscle, it is fibrous structures, but also these veins, this plexus of veins, which are located here. So what do we do if we want to work with it? Well, we go there and we put pressure on it and we stay there. We stay with the pressure. Now this pressure can actually be very painful. This area here can be really, really, really gnarly. It's not a nice area to put pressure, especially when you have a lot of tension in this area, but it is necessary. Now because this actually is really intrinsically related to your how do you call it in English? It's your lacrimal gland, so where your tears are coming out, that area is very related to it. Could be possible that when you put pressure here and you hold it, you are actually getting a bit teary-eyed. Now this is actually a good thing. Don't overdo it, but this is a good thing because it shows you that you are in the right area. Now, how do we do this? I will show you, demonstrate it to you professionally with a glove, medical glove. So what we do, you have your finger, you have the shotgun, pistol, whatever. You go upper teeth, go towards the back. Might be nice to lubricate it. Now I have a glove, but you can do it with your own hands, your own body anyway. So but just wash your hands after, it's no problem, no biggie. You go, if you lubricate it, it will slide better. Go towards the back and you will feel you are going inward at the end. So inward here. Now if this area is too small, you can with your thumb put some pressure on the right side. When you are working with the left side of your jaw, you can put some pressure on the right side here. So go back. If it's too small, that area, put some pressure. Position your jaw towards the left more, create some space, and then you can slide under it. So you go here and you put pressure and you'll feel, oh, this is not nice. This is not nice. Now I already did it today because it's just good to do it, but it's very painful. It is very, very painful. Find the barrier where it is very painful, but it is manageable, and you just stay there. You hold the pressure, you just hold it. You take some deep breaths, maybe swallow your saliva. This will actively relax this area, and you'll feel, maybe it takes a while, maybe it takes a minute, maybe two. After a while you feel it softens, it will get softer, and you will feel, oh, this is actually quite okay. And after some time you will feel, oh, I can put a lot of pressure, I won't really feel irritated. Then you are done, the tension is gone. And if this tension is gone, this blood flow out of your skull can actually go better as well, in theory. Now, why I say in theory is because, yeah, body is really difficult. So for you it might work, for someone else it might not work, but it is worth giving a shot. It really is worth giving a shot. So I am already late. It's 1:01. It's time for me to go. I have to work. Business calls. People need my help, so I'll be going. Hope this is helpful. If you have any questions, you can leave it down below. And yeah, morph well, be well, try it out. Dance with the barrier. Don't force it. Dance with the barrier. Can be quite painful. Don't break anything. Well, you can't really break anything. You have to put a lot of pressure for that. But yeah, dance with the barrier. I'll see you in the next one. Bye bye.